Hello all, this is Dr. Kirti Paladugu, Consultant Joint Replacement and Orthoscopy Surgeon, Srikara Hospitals, Miyapur. Coming to the gist of this, I would like to throw light on the joint replacements in my first part of this video. I would like to talk about the replacements, who commonly does require replacements, what are the common questions our regular people or the patients have the queries on. All these things will be discussed, and further queries you can be texted or on the links given further. Most commonly asked questions would be like, who does require knee replacement? This is very commonly known thing. Doesn't mean that each and every patient having a knee pain should undergo a knee replacement. Knee pain or considering any other joint, but most commonly heard about joints are the knees and hips because they are the weight bearing joints of our body. We do see arthritis in other parts of the body also, especially the shoulders and all those things, but most of them do recover with the physiotherapy because they are not the weight bearing portions, they do not carry our body weight. When it comes to the grading, it will be graded into 4 stages: grade 1, grade 2, grade 3, grade 4 and all. In a grade 1, grade 2, it's more of a lifestyle modification, physiotherapy and certain medications will be helping out. In grade 2, we can talk about all the recent advances like PRP, stem cells, bone marrow aspiration, BMAC what we call it as, and depending on the age of the patient and other comorbid conditions, something like whether it is an traumatic arthritis or an rheumatoid arthritis and all these things. And stage 4 variant is a deformed joint with a complete wear and tear. There is no alternative other than a replacement. Most commonly asked questions about replacement is how painful it is. That's the first question what we get from either a patient or the patient's kids or any of the attenders they come across. No surgeon would say it as a pain-free surgery, but definitely the medicine has developed to such stage that we are able to make the patient walk within few hours after surgery. I don't claim I will make them walk within few hours or something like that, but I would like to say it depends on the patient's willpower as well. It's not just the surgery what I do, and even the patient's stamina. There are patients whom I made to walk on the same day, like within 4 to 6 hours once the anesthesia is waned off. We made them walk, and there are patients definitely they do walk the next day morning. There's no doubt in that. One thing, why do we want to make them walk on the same day? The first thing is not about showing off that we are making them walk on the same day. It's boosting the confidence of the patients. When we operate them in the morning and make them walk in the evening, that confidence levels will be so high that next day morning, without we going to them and asking them to do the things or do some exercises, they themselves will be prepared for doing them. Because on the day of surgery itself, when they are able to do it, why cannot I do it the next day? That is the question what they arise within themselves, and they start doing it much faster. And we have seen the recovery of the patients to be much faster in those who have done the physio on the day 1 itself compared to day 2 and day 3 patients. So coming to the who does really require a replacement, any patient having pains in certain joints, whether it can be a knee or a hip, certain good number of months, let it be like 6 months, 9 months or whatever time it is, and they have done all the changes, lifestyle modification, not sitting low, not taking the staircase, doing the exercises daily, doing their physiotherapy, physio workouts and all in a proper way, and the medication is being followed. All these things are being taken care of, and even after that they are not able to manage with their pain, and it's hindering their day-to-day activities, like not able to walk for more than 10-15 minutes, or not able to stand in their kitchen work or household activities, not able to go to the nearby grocery shop or even a neighbor's home and all because of the knee pain, and they are on a good number of painkillers and all, and it has been there since quite a long time. They are the ideal patients who should undergo a replacement or the required treatment. What is generally done in a knee replacement? Like most of the people do come to us and ask that is the bone is replaced. We don't replace a bone. If you see in this module, I would like to just show you, this is thigh bone. On this module, if you see, the wear and tear is somewhat like this. This is how the cartilage is supposed to be. It should be smoother and linear and uniform. So it glides smoother and there is no roughened surface wherein you get pain, or there is no erosion wherein you should be getting pain. When you come to the other side, the worn out part, it will be something like this, wherein the cartilage is completely damaged and you have a roughened surface here. On this roughened surface, when you start walking, the roughened surfaces both of the thigh bone as well as the leg bone, they start rubbing against each other, and when you start doing this movement, it will be rubbing and it will be causing pain. And once the wear and tear starts, even the deformation does happen. That's why we see that most of the knees with a severe knee deformity, their knees will be something like this. We call it as bow-shaped knees. In that scenario, only that part of the cartilage whichever is damaged, it's hardly around 9 to 10 mm. That is what we are supposed to cut, and that part of the damaged cartilage is removed, which is of no use to us anymore, and that is replaced by an artificial implant. This is how exactly the implant will be looking, and you will be having particular size for your each and every individual has their own sizes as per our clothing also. So as per that, it will be sized and everything will be ready on table, and it will be fixed as per the size of the patient. So we have different materials in that. Coming to what is all done in the knee replacements and all, I basically go with an imported implant because they are more proven, time tested, and less infective rate. There are two things in this. One is like cobalt chrome, which is a commonest thing which has been in the market since last 50-60 years or over in 5 to 6 decades. And the recent upcoming is the oxynium. We don't tell it as a recent, it has already crossed over its 5 years mark, especially in Indian market. The major difference between these two would be the material which is being used. One is the cobalt chrome alloy, the other one is the oxidized form of the zirconium. The major difference between these two would be the longevity of the implant. One would come for nearly 30 years, the other one we would say it's around 15 to 20 years. So depending on the age, if someone is really younger, around 50 or something like that, we will prefer them to go ahead with the oxynium, as it is proven its results in last 5 years, and we do believe in science. And someone more than 65, definitely the call can be taken by them, by the patients, whatever they opt, we can go ahead with that. Post replacement, commonest things anybody would be feared of, even as a surgeon, what I would be feared of is the infection. To prevent infections, what is the care to be taken? Each and every care will be taken at any joint replacement center, and the standards will be set so high, as we have a specialized theaters like laminar flow theaters and all, and a special theater only for the joint replacements. All these things will be taken care of so that the chances of people handling the things, and even the well-trained OT staff or any other theater workforce should be trained in that particular system in a day in and day out manner, so that there is no deviation from what we are doing, coming from the sterilization to the end product, like putting an implant. Infection is one thing what anybody would be scared of, or the precautionary measures to be taken will be taken care of because of low immunity status or whatever it might be. If at all there is an infection also, there would be treatment for that part of the things. If it's superficial, they will be putting on some antibiotics and then curing of it. But picking up the infection is the most important thing, and worst of the worst scenario would be we would be able to revise the things if it is grossly infected. And it's the percentage and all, it will be something around less than 1% or something like that in any of the premium joint replacement centers. And next commonest question what anybody would be asking about the complications would be like, will it break? If I fall, will it break? Whether you undergo a knee replacement or not, or any other replacement or not, the amount of force required to break a bone is the same whether it is after replacement or before replacement, and it's called as a fracture, as all of us know. And if at all there is a fracture also, there is treatment for it, like whether it is a knee replacement done or not, the plates and all will be used in the same way as for a normal bone also, so do not bother much about it. The recovery phase and all will be like, patient will be staying in the hospital for 2 to 3 days, and we make them walk, we train them for their toileting activities, their household activities, come something like getting off the bed, moving to the dining and coming back, and their daily activities will be trained in these first 2 to 3 days. Once they are comfortable, they will be discharged as per their comfort zone, and we will be asking them to come back in 3 to 4 weeks time. And once they are through this phase, usually they will be more comfortable. Most of our patients do come back riding themselves or driving themselves. It's most of the scenario, they are all 60 plus patients, and once the replacement is done, usually it does come for their lifetime, and they need not turn back and see once everything is set and they are undergoing a proper physio or the exercise what has been taught in the first 1 month, if they continue doing it, there shouldn't be a problem. Most of the patients do come back saying that it's a bit painful and all. You can just ask back them if they are doing their exercise regularly. Most of your friends or some family members or anyone, neighbors would be telling you even after knee replacement are having a mild amount of pain or discomfort kind of a thing. Just we should ask them back only one question, like, are you continuing with your exercises? That is the only reason. In a knee replacement or any other replacement, I am not changing your muscular structures or any other structures. We are just replacing the cartilage which is worn out and dead, and the muscular structures, whatever are left behind with us, they are to be strengthened. They are to be strengthened, and the strengthening is only with the exercises. No medication is going to help on that, and just be regular on your exercise. Not because you have undergone the knee replacement. With the aging process, the muscles do become weak, and you have to strengthen that to hold your forces. Like for you to get up off the chair, if you want to push and get up off the chair, so your muscle has to act. Your thigh muscles, especially the quadriceps, has to be strong to push your entire body at once. And while doing the steps or getting off the bed, getting off the chair, or sitting a bit low and getting off, the muscular forces required would be tremendous, and that tone has to be maintained to be pain free and be in the comfort zone. These are the commonest things what many of our patients or the patients' kith and kin would be asking, and I guess I have answered most of them. I didn't talk much about how we do knee replacement or how we do, what implants are being put. I just briefed on the things because you find n number of videos talking only about the knee replacement, what I do, how I do, robotics, navigation, or any other things. But most commonly asked questions and commonly things like, do we require painkillers even after surgery? Do we require, does it break once you fall, if you slip and fall, or do you get infections? These are the commonest fears what anybody would be having, and even most of them will be having a fear of physiotherapy. The commonest fear, like it will be very painful. That is what people do think, and most of our videos also does show that most of our patients are walking on the same day. One of my oldest patient, and the next commonest thing asking would be the age group. What age we are supposed to get operated? There is no definition for the age in any of the books or the journals stating this is the age group what you are supposed to get your hip or knee replacement done. If someone is not able to walk and someone is supposed to be carried off, whether even a young female with rheumatoid arthritis, I can't ask her to come back around the age of 60 and get operated. Someone around, even my youngest patient whom I operated is around 34 years for a knee replacement. She was a rheumatoid patient, and now she is happily walking around and doing her household activities very comfortably. And my oldest patient is 95 years whom I did a total hip replacement for a fractured hip, and she was one of the most wonderful women. She walked on the same day, like morning I operated her, evening she was off the bed, she was walking by herself. Second day she got discharged. That is what makes us happy. That is the beauty of replacement. The youngest fellow getting fractured, we put a rod, nail, whatever imported, most expensive things also. We'll ask them not to put weight. We'll ask them to wait for at least 4 weeks, 4 to 6 weeks, and then we check the exercise and then make them walk. But the beauty of the replacement is from day one you will be off the bed. You are not dependent on others for your daily activities or the washroom activities. Even for your dining purposes and all, you don't require to be bedbound, and you don't require an attendant for your common activities or in smaller activities, what we call it as our daily activities. That is how the replacement has been evolved, and that is the awareness what people have got, and that is how the numbers have been on the increasing phase. So hope I have clarified most of the commonly asked queries, and if anything else is there, you should be feeling free to ping us. Thank you.